Hi, it's Dr. William. I have a patient here and she's going to be having a BBL. And when I saw her in consultation yesterday, I said, oh, she's a good candidate. But what I didn't tell her, because sometimes I like to keep it a little bit under wraps and not overpromise things, but she is a ticket holder, the winning combination. And so that's good news. So she has a winning combination. And what I mean by the winning combination is that she naturally has, if you feel here, she naturally has a very small waist. And she said when she was younger and that her waist was really tiny. And this is why she has a really small waist. But the winning combination is always a very small waist and a large fatty deposit here in the key area and in the flank. And so when we remove the fat from this area and the fact that she has a small waist and we do the lipo of the whole back, that usually looks very, very good. And that's why we call it the winning combination. Come with me, I gotta do a little marking and then I'll show you in the operating room what the winning combination looks like when she's on the table. So now we're in the operating room and all I've done is a lipo. So I haven't done any injection of fat yet, but you can already see that because she had that heavy deposit of fat here and because she has such a nice small waist that already without even injecting any fat, her butt already looks rounder. And look at this takeoff right here. That's why I call this the key area, because the lipo here is just really transitions nicely. And if you don't lipo here, then you end up being square because you get like a little square area here, which I don't like. Remember, all I'm doing is following the OG line, and the OG line starts way low. So it's coming up. She has a beautiful shape to her leg here. Here's where she starts to get flat. And you can see how soft that area is. And that's why I can't just fill the hip. I've got to actually fill all the way back to here. Her hip dip starts back here. So I'm going to fill all of this, fill out the hip dip, and then just work on making this OG line as smooth as I can. But that's the benefit of having the winning combination, because it already starts this process. So, all right, let's get started. And I'm going to start injecting. Okay, I've filled her right side. I have not filled her left side yet. And so you can now see that the hip dip that was over here and how this was all flat and soft is now firm because there's fat here. And I put a little bit of fat into the leg as well, just to kind of blend into that natural fat pad that she had there. And then that comes in. But you can see the difference just through the key area after building out the hip and giving her more projection and volume here. You can see the difference from that side to this side. This still looks very pretty because she has that winning combination, but it's going to look even prettier when you put fat in, because when we're looking at the OG line, it's a contrast, remember, between the convex line and then the concave line. And that concave line starts here in the key area. And so we get a better convex line when I can fill out the hip. And remember, that hip dip started way over here. So filled all of this and filled her whole gluteal area here to give her the more projection. So, all right, let me get started on the other side. Okay, good. So we're finished up. Everything went really nicely. Her left side was a little bit bigger than her right side, so I didn't put quite as much fat in the left side, in her bigger side. But the shape is really what I'm happy with. And I always really like to be looking down because that's the line. So her convex OG is really pretty. And then because of that nice small waist and her large amount of fat there preoperatively, that concave is really coming in nicely. There's always some loose skin here. When we finish, the skin has to tighten and re-drape. So if you just kind of tent the skin up a little bit, then you can really kind of see how it starts coming through into the key area. So convex part of the OG, and then coming up into the concave part of the OG. So it looks really nice. So we'll take a look in a few months and see how she's doing.